Hi guys, welcome back to Code Master Coach, your medical coding tutor. Guys, we're continuing our review of the 2025 ICD-10-CM official coding guidelines. And we're going to continue where we stopped at part 18. I'm hearing from so many of you that you're glad I'm back and that we're going to go over these guidelines, that you guys could read them on your own, but it helps to hear somebody else go over these, and I can appreciate that. So we stopped at E, fetal conditions affecting the management of the mother. And we're at 1, codes from category O35 and O36. So let's go to these guidelines and see what these guidelines say. Codes from categories O35, maternal care for known or suspected fetal abnormality and damage, and O36, maternal care for other fetal problems, are assigned only when the fetal condition is actually responsible for modifying the management of the mother, i.e., by requiring diagnostic studies, additional observation, special care, or even termination of the pregnancy. The fact that the fetal condition exists does not justify assigning a code from this series to the mother's record. Okay, so let's go back to my notes here. I just stated a note that says the fact that the fetal condition exists, again, does not justify assigning a code from 035 or 036. These codes are only used when the condition is in the fetus is the reason for the mother's hospitalization or other obstetric care, or even the termination of the pregnancy. For example, abnormal fetal heart rate or rhythm, fetal viability that results in the mother having to go through an ultrasound to determine if there is even a pregnancy, or even decreased fetal movements that result in a C-section or even early induction of labor. Because these resulted in additional care being rendered to the mother, then they justified being conditions that needed to be caught while the fetus is still in utero. Okay? Number 2 says in utero surgery. Go to the guidelines. So let's pull those guidelines back up. It says in case when surgery is performed on the fetus, a diagnosis code from category 035, maternal care for known or suspected fetal abnormality and damage, should be assigned, identifying the fetal condition. Assign the appropriate procedure code for the procedure performed. No code from chapter 16, which is the perinatal codes, should be used on the mother's record to identify fetal conditions. The surgery performed in utero on the fetus is still to be coded as an obstetric encounter. So understand what's going on here. It's saying that when the surgery is performed on a fetus that is still in utero, it is considered an obstetric encounter, not a perinatal or natal. It's an obstetric encounter. So codes from chapter 16, which are certain conditions originating in the perinatal period, should not be used on the mother's record to identify the fetal condition. Instead, a category 035, maternal care for known or suspected fetal abnormality and damage, should be assigned for the fetal condition. So it gets a little tricky there. And then also says don't forget to assign a code for the procedure. So it's a little tricky, but because these are done in utero and they're affecting the mother, then these codes will go on the maternal record, and it's identified with maternal codes and not perinatal codes. They're affecting the mother. But also don't forget to assign your code for the procedure. All right, F is on HIV infection in pregnancy, childbirth, and the puerperium. And it says go to the guidelines. So let's go to the guidelines first. F, HIV infection in pregnancy, childbirth, and puerperium. During pregnancy, childbirth, or the puerperium, A patient admitted because of an HIV related illness should receive a principal diagnosis from subcategory 098.7, human immunodeficiency disease complicating pregnancy, childbirth, and the purpurium, followed by the code or codes for the HIV related illnesses. Patients with asymptomatic HIV infection status admitted during pregnancy, childbirth, or the purpurium should receive codes of 098.7 and Z21, asymptomatic human immunodeficiency virus HIV infection status. So let's go back here and see what F says. It just has a note that says 098.7, human immunodeficiency virus HIV disease complicating pregnancy, childbirth, and the purpurium. Codemaster Coach, my number one saying my students will always tell you is I always say, love your code books, and they will love you back with the right answer, because I am determined to teach my students if they could love on those. When you love somebody or you love something, you spend time with it. You get to know it. Spend time with your code books. Get to know it. Before this video is finished, I am going to show you where your code book gives you answers. It tells you what to do, but you have to know them well enough to know that they're telling you what to do. If you look at code 098.7, it tells you to use additional code to identify the type of HIV disease. Let me show that to you. And it's in your code book. It's telling you to do that. So 098.7, I'm going to enlarge it for you right here. 098.7, human immunodeficiency virus, HIV disease, complicating pregnancy, childbirth, and purpurium. Use an additional code to identify the type of HIV disease. Is it acquired immune deficiency syndrome or AIDS? B20. Is it asymptomatic HIV status? Z21. Is it just an HIV positive not otherwise specified? Z21. Or is it symptomatic HIV disease? B20. So it's telling you in your code book, in case you forget to code in pregnancy. Remember last week we said in part 17, when the woman is pregnant, for specificity purposes, code in pregnancy, which is usually the O code for the pregnancy and pregnancy-related complications, but also code outside of pregnancy. Give it the specificity that it needs with the additional code identifying what HIV, what type of human immunodeficiency virus does the patient have. And your additional code identifies what it is. So again, your code book is giving you the answers. It's telling you at the code, use an additional code. But you got to see that to know to use it. All right, let's keep going. Look at diabetes in pregnancy, G. So let's look at the guidelines. Let's go down to G. Diabetes mellitus is a significant complicating factor in pregnancy. Pregnant patients who are diabetic should be assigned a code from category 024. Diabetes mellitus in pregnancy, childbirth, and the purpurium first, followed by the appropriate diabetes code or codes from E08 through E13 from chapter 4. So let's look at it on my little handout. G. Category 024, diabetes mellitus in pregnancy, childbirth, and the purpurium, distinguishes between pre-existing diabetes, including type 1, type 2, or other, or unspecified, gestational diabetes, and unspecified diabetes. So again, 024 identifies pre-existing, gestational diabetes, and unspecified diabetes. Gestational diabetes, which is pregnancy-induced diabetes, can occur during the second and third trimester of pregnancy in women who were not diabetic prior to pregnancy. Code Z79.4, long-term use of insulin, should be assigned as an additional code if the pre-existing or unspecified diabetes mellitus is being treated with insulin. Code Z79.4 should not be assigned if insulin is used temporarily to bring the blood sugars under control in a patient with pre-existing type 2 diabetes. And in code Z79.84, long-term use of oral hypoglycemic drugs should be assigned if the pre-existing or unspecified diabetes mellitus is being treated with oral hypoglycemic drugs, medication that you take by mouth. However, pay close attention to the note at code 024.4. Let me show you something. Remember I said, love your code book and it will love you back with the right answer. Let's go down to 024.4. Notice, gestational diabetes. It refers you to the official coding guidelines, which is what we're talking about. Gestational or pregnancy-induced diabetes. Do not report Z79.4 or Z79.84 with codes in this category of diabetes mellitus arising in pregnancy or gestational diabetes mellitus not otherwise specified. Notice, because it identifies diet controlled, insulin controlled, controlled by oral or hypoglycemic drugs. You don't need an additional code. Your code book is telling you, do not report Z79.4 or Z79.84 with codes from this category. So your book is helping you and it's telling you this. You just got to know to review your book. Look at your book. Know your book. Love on your book, as Coach always says. All right, let's look at H, gestational diabetes-induced diabetes. And that's pretty much what we're covering here. Gestational or pregnancy-induced diabetes can occur during the second and third trimester of pregnancy in patients who were not diabetic prior to pregnancy. Gestational diabetes can cause complications in the pregnancy similar to those of pre-existing diabetes mellitus. It also puts patients at greater risk of developing diabetes after the pregnancy. So codes for gestational diabetes are in subcategory that 024.4, which I just showed you, gestational diabetes mellitus. No other code from category 024, diabetes mellitus in pregnancy, childbirth, and the puerperium should be used with the code from 024.4. Make sure I say that again. No other code from category 024, diabetes mellitus in pregnancy, childbirth, and the puerperium should be used with the code from 024.4. The codes under subcategory 024.4 include diet controlled, insulin controlled, and controlled by oral hypoglycemic drugs. If a patient with gestational diabetes is treated with both diet and insulin, only the code for the insulin controlled is required. And if a patient with gestational diabetes is treated with both diet and oral hypoglycemic medication, only the code for the controlled by oral hypoglycemic drug is required. Notice code Z79.4, long-term current use of insulin, Z79.84, long-term current use of oral hypoglycemic drugs, and Z79.85, long-term or current use of an injectable non-insulin anti-diabetic drug should not be assigned with category or codes from subcategory 024.4. And remember, it tells you that at that code, but you've got to see that note. An abnormal glucose tolerance in a pregnancy is assigned a code from subcategory 099.81, abnormal glucose complicating pregnancy, childbirth, and the puerperium. Let's go back to my notes. And it says, I said just go straight to the guidelines because that's exactly what we covered. Remember, at 024.4, do not report Z79.4 or Z79.84 with codes in this subcategory. None of these, because they're already identified. Okay? So 024.4, you do not need an additional code for the insulin. All right, let's see if there's anything else on my handout here. Well, let's stay here. Okay, next video is on J, sepsis and septic shock complicating abortion, pregnancy, childbirth, and the purpurium. So hopefully you're following along with me. This is making sense, and I will see you guys in the next video. Don't forget to subscribe, and I will see you next week. Thanks.